Okay, folks, I think we're ready to go. Well, we have a lot of participants. This is really spectacular. Okay, thanks everybody for joining. Thank you for joining. This is this webinar called Nutritional Medicine and Concussion. I hope you can hear me okay. I hope you can see me okay. This is a very important topic, of course, very timely, because as you know, there's tremendous awareness about concussions, much more so than there was, 10 or 15 years ago, or back in my very active days in practice. A person would have a whiplash injury and, you'd be looking at their cervical spine to see where the headaches were coming from. And often you'd find lesions there. But, we didn't, back in the day, we didn't have as great an appreciation for the actual brain injury that was going on concurrently. It was also accounting for the patient's symptoms. So what you're going to see in this presentation is how critical it is to repair that brain damage using nutritional medicine interventions. And I'm going to show you the research on that. And the research on that comes from these peer-reviewed papers. I'll show you some other peer-reviewed papers throughout the presentation, but unless otherwise stated, the research that I'm citing is from these 6 really important sources that I would suggest, if you have a chance, you read these research papers yourself, but I'm going to summarize what's in them as we go along here today. So as you know, concussion and mild traumatic brain injury are the result of rapid deceleration of the brain within the skull that imparts shearing or torsional forces to neural tissue, followed by, and this is where nutrition plays a role, metabolic and mechanical changes. So these metabolic and mechanical changes and the damage that causes this needs to be repaired, and there are no drugs that can repair it. Really, only nutritional support has a chance to repair these disruptions unless the damage has become permanent. But in most cases, that's not going to be the case. This doesn't just apply to head trauma, but it applies to whiplash injury patients, of course, athletes that have, any kind of sudden deceleration injury or impact to the head, and recreational athletes as well. And even some slip and fall patients that you see along the way, where you've had this sort of sudden movement of the brain within the skull and sort of banging against the skull and damaging neural tissue and bruising it, as you see here on the left. And then, of course, the second impact injury is even worse. So once there's already some existing damage, if it doesn't completely heal, as you know, the second impact makes things worse because you have more swelling and you further reduce blood flow to neural tissue, so it can't get access to the nutrients that it requires for the kind of complete repair and restoration of normal brain function that you're trying to achieve. So the overall pathophysiology in concussion, when we start looking down at the cellular level, you'll really see where nutritional medicine plays a key role here. But the different features of it are that you have diffuse axonal injury. So the axon is tremendously damaged. So the flow of peptides and things from the cell body down through the axon to the end plates is disrupted. And of course, the retrograde flow of peptides and other nerve chemicals traveling back towards the nucleus to give the nucleus information as to what's happening at the end plate is also interrupted. I will show you some graphic illustration of that. So the microtubule dependent transport of vesicles containing brain-derived neurotrophic factor is reduced in brain injury as well as in Huntington's disease and Parkinson's disease, resulting in a reduction of trophic support and subsequent neuronal cell death. If that doesn't get repaired over time, if you can't have communication between the nucleus and the end plate via the axon flow, then eventually you're going to have cell death. So the faster you can repair that damage, the better. You also get immediately after the impact is initial depolarization of the neuronal membrane. So all of a sudden, calcium, magnesium, potassium, and sodium are all being released and diffusing across the membrane in a sort of a hyper-excitability state, which is, you can't sustain that or you end up with all kinds of symptoms. And also the massive release of glutamate from the vesicles. A little bit of glutamate is okay, but a massive amount of glutamate causes it's toxic to the nerve cell and can lead to nerve cell death. So you want to try to contain that excessive glutamate damage and also restore the nerve cell membrane and get the electrical potential of the nerve cell repaired or normalized as quickly as possible. Nutritional medicine is the only way to do it. You also get a hypermetabolic state. So right after the injury, the brain figures it needs more energy in order to repair the damage. So it starts to burn glucose at a much faster rate. But as it burns glucose, because the mitochondria is damaged, a lot of the electrons that end up sort of going into the mitochondria to produce ATP are leaking out of the membrane and producing all kinds of free radicals, reactive oxygen species, which actually start to damage the mitochondria further and damage the cell membrane and damage the nucleus of the cell, causing DNA mutations. And at the same time, you're producing, even though you're trying to produce more ATP energy, you end up producing less because the mitochondria is damaged. I will show you how all this comes together. So you get this mitochondrial injury. So as the electrons are flowing down, they can't flow normally. So they leak out of the membrane and they react with oxygen in the cytosol of the nerve cell. And when it interacts with oxygen too prematurely, you form reactive oxygen species or free radicals, damaging the cellular DNA, the membrane of the cell, and also the mitochondria itself. And you're getting also inflammation. Those free radicals produce inflammation, but you're also getting an upregulation of the enzymes that produce prostaglandin series 2 from arachidonic acid, which produces more inflammation. And because you have all these sodium ions moving intracellularly across the membrane, it pulls water with it, and you get edema and inflammation within or swelling within the nerve cell itself. So you want to try to restore all of this as quickly as possible. You also get a release of enzymes that are going to break down key proteins inside the cell. This proteolysis occurs, and you start damaging different enzymes and nerve growth factors and structural proteins. And the body needs to synthesize new ones. And you get a decrease of blood flow because after the impact for several days, there's this influx of calcium that damages the mitochondria, but also causes blood vessels to constrict. So you're getting less blood flow to the brain for days on end unless you can repair that membrane and allow normal ionic concentrations on both sides of the membrane. And you also decrease the synthesis of acetylcholine, which is the major neurotransmitter in the brain required for memory. And other neurotransmitters also go into a deficit position in terms of concentration. So sometimes you see decreased serotonin, which can lead to sort of depression, decreased norepinephrine and dopamine. So the concentration ability can also be affected. So you want to try to correct all of this. So here's the hyperglycolytic state I'm talking about. So remember that the nerve and brain cells rely exclusively on blood glucose as their source of energy. So after an injury, they try to take up even more glucose from the bloodstream. Remember, the nerve cells don't need insulin to extract glucose from the bloodstream, right? They have a different type of GLUT transporter, but they can bring glucose in rapidly. And in the cytosol of the cell, they'll convert glucose down to pyruvic acid and produce a couple of ATP molecules, but not enough to really be of any major significance. So then once you have pyruvic acid, you'll recall this once I show it to you. I lost my cursor. Once you have pyruvic acid, then what happens is that here's the glucose being burned down to pyruvic acid. And then it basically can diffuse into the mitochondria and become acetyl coenzyme A and bind with oxaloacetate to form citrate. And then in the Krebs cycle, I don't want to scare you with the Krebs cycle, but all that's happening in the Krebs cycle is hydrogen electrons from these little intermediates are being plucked off by niacin in the form of NAD to form NADH, and also by riboflavin, FAD becomes FAD. So you're just plucking off hydrogen electrons, and you're going to take them over to the electron transfer chain. And as they go down the different cytochromes in the chain, I'm going the wrong way. So as they get into the mitochondria, into the cytochrome chain, the hydrogen electrons go down like a little step down transformer system. And as they go from a higher level of energy to lower, to lower, to lower, they're giving off energy in between those steps. And that energy is going to be used to recouple ADP with inorganic phosphate to make more ATP. And the nerve cell is going to use the ATP to produce the energy it needs to repair the damage and keep the nerve cell functioning in a normal way. So you'll see that in the cytochrome chain that here's NADH, bringing in the hydrogens in, and also FAD. And as it goes down the chain, eventually, and CoQ10 is going to help transfer these hydrogen electrons down the chain. Once you get 4 hydrogens at the bottom of the chain, it's going to interact with oxygen to do a 4 electron reduction to form water. Water is not toxic. So it's when the electrons leak out of the chain prematurely that they interact with oxygen in an abnormal way and form free radicals. But as the hydrogens are going down the chain, the energy that's given off is going to be used to recouple ADP with inorganic phosphate to make ATP. The energy that the body, if there's not enough energy given off at certain points, that energy is used just to heat the human body so that we maintain a normal core temperature. So that's sort of what makes us warm-blooded animals. So as the hydrogens are going down the chain, eventually you'll form water at the end, and ATP is formed as you go along as well. But when you have, normally about 2 to 5% of the electrons leak out of the chain under normal conditions, so you're always generating some free radicals. But after head trauma or a head injury, or any type of deceleration injury where they have impact of the brain hitting the skull, the mitochondrial membrane becomes disrupted, and more electrons start to leak out of the membrane, and you form more reactive oxygen species, and they start to do a great deal of damage and also promote more inflammation to occur. So you need to be repairing this as soon as possible. This is what the axonal injury looks like. So here's the nerve cell, the nucleus here of the nerve cell in the cell body. And here's the axon, and here you get down to the end plates. And when you have damage to the axon, this axonal disruption, the microglia, remember, are an extension of the monocyte macrophage lineage of sort of white blood cells, but this sort of, they take up residency in the brain. They can start to repair the damage if the damage is not permanent. But during this stage of sort of diffuse damage here, then nerve cell function is tremendously impaired. You want to try to repair that as quickly as you can if it's possible to do it. So again, inside the axons are these microtubules, these little tubes that allow peptides and growth factors that are synthesized here around the nucleus and with the help of the endoplasmic reticulum and the ribosomes. Once they're formed, they can be transported down these tubules to the end plate to maintain normal nerve function. And also some other communication occurs retrograde, going back to the nucleus to tell the nucleus what is the status of things here down around the end plate, where near these synapses where all these neurotransmitters are released. So this communication is vital, and it needs to be repaired and restored as quickly as you can. Then you have this release of glutamate from the terminals of the nerve cells, which glutamate is going to act as an excitatory type of neurotransmitter. But too much of it actually is toxic to nerve cells. So normally what the body does is it controls the release of glutamate, and once it gets released, it gets picked up by the astrocytes. And then the brain, remember, is picking up amino acids like tryptophan and phenylalanine, and taking the amide group off and then using them to make serotonin and epinephrine and norepinephrine and dopamine, right? It's made from those amino acids. But first you have to take one of the amide groups off. So now you're building up a lot of ammonia in the brain, so that those amide groups get put onto glutamate. Get put onto glutamate to form glutamine, which is very non-toxic. Glutamine can exit and get into the central circulation. Or the formation of glutamine also supports the synthesis of glutathione. You need glutamine in order to make glutathione, a very important cellular antioxidant. So the brain has control over how much glutamate it's going to have in this free form, If it gets beyond a certain point, as occurs in brain injury or head trauma, then the glutamate levels go high and you have a toxic buildup that can also lead to nerve cell death. So when we look at the overview of things, before we look at how nutritional medicine restores it, upon impact, you have massive release of glutamate. You have this depolarization of the nerve cell membrane with a massive release of ions going across the nerve cell membrane: calcium, magnesium, sodium, potassium. Everything gets messed up. You get this hyperexcitability state, and all the extra calcium coming in is eventually going to damage some of the mitochondria, and it's also going to cause constriction of blood vessel flow as well. And then you get this rapid uptake of glucose for the first little while, and because it can't be used properly, you start to generate a lot of free radicals here in the mitochondria, and those free radicals start to damage not only the mitochondria, but also the nucleus-forming mutations and also the nerve cell membrane. And then you have, by 30 minutes, either brain enters a prolonged decrease of glucose uptake because the blood flow is now constricted. And then you have this axonal injury occurring here along the axon that needs to be repaired unless the damage is irreparable. So the goals of nutritional medicine in concussion, as the research shows, and in traumatic brain injuries, in post-concussion syndrome, is you want to try to help the patient repair the plasma membrane, the cell membrane. You want to help to increase the memory chemical acetylcholine and support the synthesis of dopamine, serotonin, and norepinephrine. You want to reduce the inflammatory response. You want to increase ATP energy so you can do the repair that's necessary to reverse the mitochondrial dysfunction and give the cell the energy it needs to repair itself. You want to provide increased antioxidant protection to sort of quench the free radicals that are being generated, and you want to decrease the damage that's being done by L-glutamate. You want to improve cerebral blood flow so you get more oxygen and glucose and other nutrients to brain cells. And you want to stabilize and repair the microtubules in the axon so that you get normal anterograde and retrograde flow from the nucleus down to the end plate. So nutritional medicine factors into all of this. So when we talk about the nerve cell membrane, remember that the membrane of all the cells of the body are made up of phospholipids, a bilayer of phospholipids. And of course, there's receptors on the cell surface, certain glycoproteins. But when we look at the phospholipids themselves, remember that they're made of a glycerol backbone that have two fatty acids attached, and then a polar group, like choline or inositol or serine. So you would form phosphatidylcholine or phosphatidylserine, phosphatidylinositol. And these fatty acids that are on the fatty acid chain are a mirror image of the kind of fats the person's eating in their diet. So if they're eating a lot of saturated fat from beef and pork and butter and coconut oil and trans fats, deep fried foods, then these kinds of fats become the fats that start to esterify these phospholipids. And those kinds of fats are very hard and make the brain very rigid. You're not going to repair brain cells if those are the kinds of fats that are the predominant fats in the diet. On the other hand, certain polyunsaturated fats, like the omega-3 fats, even monounsaturated fats, when they attach here, they make the phospholipids much more fluid, so the cell membrane is more fluid, and the channels that allow things to move back and forth are more normalized. But what's really critical here is that when the second fatty acid, what have I done? When the second fatty acid right here is DHA, docosahexaenoic acid from fish oil, then it really increases the synthesis of these phospholipids in a way that repairs the nerve cell membrane in a significant way. So keep that in mind because we're going to see it again. So in the nerve cell membrane, not to scare you too much, but you know, you're a doctor, so let's understand this. So the way that the nerve cell membrane is making these phospholipids is it takes glycerol. Where does it get glycerol? From intermediates of from glucose metabolism. They can pluck off glycerol, glyceraldehyde, convert it to glycerol 3-phosphate. And then it takes two fatty acids and attaches it to glycerol to form phosphatidic acid. Then from there, it can add inositol to form phosphatidylinositol, which is one of the phospholipids here. Or phosphatidic acid can pick up this OH group and become diacylglycerol. And then it can form from there phosphatidylethynoalanine and also phosphatidylserine. But in the presence of CDP choline, and this is critical, if you can get more CDP choline into the brain, then diacylglycerol will form phosphatidylcholine, and that choline will then be used to make acetylcholine, which is the neurotransmitter that provides memory to the brain. So again, making phosphatidylcholine becomes really critical. So here you see the choline becoming choline phosphate, CDP choline, and then it can attach to diacylglycerol to form phosphatidylcholine. So if you can get CDP choline into the brain or increase the concentrations of CDP choline in the brain, you can make more phosphatidylcholine, which has been used to repair damage in concussion injuries, as we'll see. Now notice that phosphatidylethynoalanine, let's go back one slide. If you can make phosphatidylethynoalanine, which the brain can easily do, it can also form phosphatidylcholine, but in order to do it, it needs SAMe, or S-adenosylmethionine, here, and here, and here, and then you can also make phosphatidylcholine this way. Well, to make SAMe, or S-adenosylmethionine, you need folic acid and vitamin B12. So let's look at that, because in 60% of Caucasians, they're missing this particular enzyme known as the methylene tetrahydrofolate reductase enzyme. So when folic acid goes into your body from supplements or from food, the folic acid normally travels down this series of pathways, and eventually you're hoping it will also get to become 5-methylfolate, as we call it. And it'll have a methyl group that it picked up from either serine or glycine on its way down. And then it'll hand that methyl group over to homocysteine with the help of vitamin B12 and methionine synthase enzyme. So this form of folic acid is critical to hand the methyl group over to vitamin B12 and methionine synthase. So you reconvert homocysteine to methionine. Once you have that, you can form S-adenosylmethionine that's required to make the different types of phosphatidylcholine and other phospholipids, which you'll see in a moment. So about 60% of Caucasians have a mild defect, at least in this enzyme, where they're ingesting enough folic acid. So when you look at their blood level of red blood cell folate, it's normal. You look at their serum B12, it's normal, but they have high homocysteine levels, right? Because if you can't convert folic acid to this form of folic acid, then you can't hand off the methyl group to B12 and convert the homocysteine to methionine. So homocysteine builds up, it leaks into the bloodstream. You have high homocysteine in the presence of normal red blood cell folate and serum B12. That's an indicator that the person has a defect in the synthesis of S-adenosylmethionine, because S-adenosylmethionine is vital here, as you see, as you convert homocysteine to methionine. Now you form SAM, or S-adenosylmethionine, and you need that to convert phosphatidylethynoalanine into phosphatidylserine, both in the choline, both in the brain, but also in the liver. And that choline from phosphatidylcholine becomes acetylcholine. So the more phosphatidylcholine you synthesize, that's incredibly important. So day to day, you need enough folic acid and B12 to do this. Some people have a mild defect where they really demand a little bit more folic acid and or B12, or they're going to demand additional folic acid in the form of methylfolate. So in the liver can convert homocysteine to methionine with the help of choline. So in the liver, some choline becomes betaine, or what's known as trimethylglycine. Hear the word trimethyl, so betaine can donate one of its methyl groups to homocysteine, the same way that folic acid could do it over here. In the liver, betaine can provide that methyl group to homocysteine to form methionine. And when that happens, then more of the folic acid is available to be used in the brain to produce more of the methionine that you're going to need to make S-adenosylmethionine. So one of the great sources of choline is ingesting lecithin capsules, by the way. So once the liver gets access to betaine from ingesting more lecithin, then it makes more methionine, from which it can then make more phosphatidylcholine from phosphatidylethanoalamine, as we saw earlier, that you need SAMe to convert phosphatidylethanoalamine to phosphatidylcholine. And then it puts it into the high density lipoprotein, the HDL. And the HDL can cross the blood-brain barrier and bring more phosphatidylcholine into the brain. And the brain can also make more phosphatidylcholine itself, using methionine that it's going to get with the help of folic acid. So when you supplement with CDP choline, and this is what I'm getting to now, is that supplementation with CDP choline has been shown to give the brain more CDP choline from which it can make more phosphatidylcholine much faster to repair brain injury. And you're going to see the research on this. Now, it's not that the CDP choline, you ingest it gets absorbed and it crosses the blood-brain barrier and everything's hunky-dory. The body's a little bit more complicated than that. So just follow me. Because you're a doctor, I want you to understand how this really works. So when you ingest CDP choline supplements, it gets digested in the gut, and some of the cytidine from what considered CDP choline is known as cytidine diphosphocholene. So some of the cytidine gets converted to uridine, and the uridine then can form uridine triphosphate, and then in the brain it can form cytidine triphosphate. So that cytidine triphosphate becomes important because as some of the choline gets into the brain, then in the presence of cytidine triphosphate, it can form CDP, it can resynthesize CDP choline. So you swallowed CDP choline, it tore it apart, but eventually puts it back together as CDP choline in the brain. Once you have that, you can make more phosphatidylcholine. Fantastic research on this by this guy Wertman. When I was studying to do my master's degree in nutrition back in the early 1980s, this guy Wertman was already doing all the research to see if you could increase brain levels of acetylcholine in older patients to help prevent dementia from happening. So this guy spent his whole life on this research. So once again, what you're trying to do is to make more CDP choline. And this conversion happens to make more phosphatidylcholine with the help of CDP choline here. But this reaction happens faster in the presence of DHA, which is the fish oil, docosahexaenoic acid. You create more phosphatidylcholine. So the combination of CDP choline with a high yield fish oil, high in DHA, is how you start to repair the nerve cell membrane. Once again, you see it here, choline moving down the pathway in the presence, once it gets to be CDP choline with the help of cytidine triphosphate. And in order to make cytidine triphosphate, you need to swallow CDP choline supplements, and then you have CDP choline, and then with one step, you're forming phosphatidylcholine for more nerve cell repair and more choline available to make the acetylcholine, which is the brain chemical. All right. So just to recall again what those phospholipids look like, they're a glycerol backbone. They've got two fatty acid chains, and these fatty acids are diet dependent. When the R2 one is DHA and you have enough CDP choline, you're going to form phosphatidylcholine all day long. You're going to repair nerve cell brain damage, and you're going to increase acetylcholine synthesis. The other benefits of CDP choline supplementation are that it reduces the activity of phospholipase A2, which is the enzyme that converts arachidonic acid into prostaglandin series 2. So that reduces brain inflammation. Cytidine also increases phosphatidylcholine synthesis, but it also increases glutathione synthesis, a very important antioxidant in nerve cells. And it also increases the uptake of glutamate by astrocytes to remove them from the synaptic cleft, so you have less glutamate toxicity to the nerve cell. So this repairing the nerve cell membrane with the right essential fatty acids and CDP choline is vital. Now you want to reduce inflammation. Well, we saw that CDP choline could do that by inhibiting the conversion of arachidonic acid into prostaglandin series 2. But omega-3 fats also factor in, because here's icosapentaenoic acid, EPA. In one step, it becomes prostaglandin series 3, which reduces inflammation. And remember that alpha-linolenic acid from flaxseed oil can be elongated slowly to EPA and also help to reduce inflammation. while slowing the conversion to arachidonic acid. When you have a lot of arachidonic acid, you're going to form more prostaglandin series 2, and that's going to produce more inflammation. So again, that arachidonic acid released in nerve cell injury from phospholipase A2, you're forming more of the inflammatory prostaglandins. You want to try to inhibit that. So CDP choline inhibits that release. And if you have less arachidonic acid and you have more of the omega-3 fats, then the eicosapentaenoic acid will form the anti-inflammatory cascade of prostaglandins and leukotrienes. Whereas if you have a lot of arachidonic acid in your head, because your diet's pathetic, then you're going to produce more pro-inflammatory. So diet and supplementation, and when time allows, low-grade exercise becomes critical to repairing the injury. So to reduce inflammation, you want omega-3 fats. Are there studies that show this? Yes. They're important for structural components of the brain cell membrane because they esterify the phospholipids and they improve the fluidity of the cell membrane, the thickness, the cell signaling, because the receptors on the cell surface are more fluid. They can pick up signals better, and it improves mitochondrial function. Whereas if the person's diet is high in long-chain saturated fats from butter and coconut oil and palm oil and pork and beef and high-fat dairy and creamy salad dressings and cream sauces and mayonnaise and trans fats that give you these deep-fried foods, you're going to create a very rigid cell membrane when you do that. So I heard one of these chiropractic experts talking about concussion management, encouraging patients, their chiropractors tell their patients to have more coconut oil. I'm like, some of your other research looks very fascinating, but you obviously haven't looked at the nutritional medicine research on this. That is really information that has no merit in repairing the nerve cell membrane and improving recovery from brain injury. Whereas with EPA and DHA, they highly enrich neuronal plasma membranes if you put enough of them into your body. And DHA is, when you do it right, is the predominant omega-3 fat in neuronal membranes. That's the fatty acid that nerve cells are looking for. But man, if you don't swallow it, you ain't getting it. But remember that from flaxseed oil, the alpha-linolenic acid, the body can elongate it to EPA and to DHA. So that's sort of a backup reserve of DHA as well. And DHA also increases phosphatidylcholine, phosphatidylserine, and phosphatidylethylalamine production and promotes neurite outgrowth during both development and during adult life. So DHA is critical. In animal models, fish oil effectively reduces post-traumatic elevations in protein oxidation, resulting in stabilization of multiple molecular mediators of learning, memory, cellular energy homeostasis, mitochondrial calcium homeostasis, as well as improving cognitive performance. DHA has provided neuroprotection in experimental models of both focal and diffuse traumatic brain injuries. Studies in other models of neurological injury have revealed a variety of potential mechanisms of neuroprotection, in addition to DHA and EPA's well-established antioxidant and anti-inflammatory properties. Some studies show that DHA provided prophylactically. Look at this. Let's say you have an athlete who plays a sport where collisions are not uncommon, even soccer players, using their head to knock the ball into the net or to pass it. Any kind of trauma, the higher the DHA concentrations in the brain might help to mitigate some of the damage that's done if the brain gets traumatized later. So enriching the neuronal membranes with DHA is critical on the therapeutic side, but we think even prophylactically. In human studies, this is this group called the Brain Health Education and Research Institute. For concussions and mild cases of traumatic brain injury where patients are able to swallow on their own, so they're not unconscious, a protocol with fish oil capsules or liquid equivalent has been used extensively. It's published by this group. The protocol they use is 5,000 milligrams of concentrated fish oil in triglyceride form. Well, that's usually how it is, providing approximately 3,000 milligrams of omega-3 fats of EPA and DHA, consumed 3 times a day for a minimum of 1 week before decreasing to twice a day and eventually once a day. Anecdotally, this tapering provides a more immediate benefit, improving mood, calmness, headaches, cognitive function, and the large doses in the beginning act more as a loading dose to overcome the relative deficit of omega-3 fats found in most people. Most people from day to day are already walking around with a deficit of omega-3 fats in their brain. So the loading dose helps to get the concentrations up. Then you can taper off once those concentrations get higher. Then to reduce inflammation, you also want curcumin. The animal studies support this because curcumin crosses the blood-brain barrier. Not everything crosses the blood-brain barrier. And when it does that experimentally, and we'll see in animal studies, it reduces a lot of inflammatory mediators like interleukin-1, nuclear factor kappa beta. I'll show you what that is. And it inhibits the cyclooxygenase and lipoxygenase enzymes that convert arachidonic acid into prostaglandin series 2 and the inflammatory leukotrienes like leukotriene B4. So it's reducing edema. And some studies show that curcumin provided prophylactically may also reduce extent of brain damage in traumatic brain injury models. So here's nuclear factor kappa beta, in case you don't know what it is. It's in the cytosol. It's known as a transcription factor. Normally it's just lying there dormant, but when it gets stimulated by certain signal transduction pathways, it'll go to the nucleus and stimulate the release of all kinds of inflammatory cytokines like interleukin-1 and interleukin-6 and other ones. So curcumin's been shown to sort of tone that down so you don't get this massive inflammatory release. Because when nuclear factor kappa beta is activated, you get neuroinflammation, and also it increases the synthesis of amyloid plaque that becomes a hallmark feature of Alzheimer's disease. So you understand the correlation between head trauma, concussion, and subsequent development of Alzheimer's disease in athletes that we've seen this many times now. So nuclear factor kappa beta is one of the signaling mechanisms that upregulates these particular programs. You want to tone it down. Curcumin has been shown to be one of the molecules that has great promise to do that by inhibiting nuclear factor kappa beta, blocking the release of the interleukins, and blocking the receptor on the cell surface that triggers the release of nuclear factor kappa beta. And also inhibiting pathways that lead to nuclear factor kappa beta, like phosphatidylinositol, phosphoinositol 3 kinase, and the AKT. It modulates the amount of nitric oxide, and it blocks those enzymes that produce prostaglandin series 2 and the leukotrienes that are inflammatory. So it's having all these great effects on brain health. So animal studies really show this. Reducing post-traumatic elevations in lipid peroxidation and protein oxidation, as well as disturbances in plasma membrane turnover and phospholipid metabolism. So it's helping to reduce the inflammatory response and the release of these fatty acids to be used in inflammatory prostaglandin synthesis. It prevented reductions in proteins important for learning, memory, synaptic transmission, and promoted cellular energy homeostasis, probably by stabilizing the mitochondria membrane as well. Post-traumatic administration of curcumin supplement also improved injury-associated behavioral impairment, thereby suggesting that curcumin-induced normalization of multiple molecular mechanisms may help preserve neuronal structure and function during the post-injury period. So you want to try to repair the plasma membrane, reduce inflammation and the inflammatory mediators, and now you want to try to increase the synthesis of acetylcholine. Well, in the brain, some of the phosphatidylcholine that's in the nerve cell membrane can be released, and that choline in one simple step becomes the memory chemical acetylcholine. Notice that serine from phosphatidylserine can also be released to form choline, and from there choline forms acetylcholine. So both choline and serine become precursors to making more acetylcholine. The more you can resynthesize phosphatidylcholine and phosphatidylserine in the nerve cell membrane, the faster the person's brain is going to be able to make the memory chemical, and now they can remember things and they can get back to having better memory function in general. So to support acetylcholine synthesis and also other neurotransmitters like dopamine, serotonin, norepinephrine, this is where CDP choline and lecithin supplementation have shown tremendous importance. Human studies in young and older subjects demonstrate that supplementation with CDP choline and or lecithin, which is high in choline and phosphatidylcholine, can increase the brain levels of acetylcholine. Both CDP choline and phosphatidylcholine found in lecithin, that's where phosphatidylcholine is found, crosses the blood-brain barrier facilitated by a choline transporter, or in the liver, the HDL that carries the phosphatidylcholine can cross the blood-brain barrier and deliver some of those phospholipids to the brain directly. And then they're subsequently incorporated into the neuronal membrane as part of the phospholipid structure. And then the choline and the brain phospholipids, of course, serve as a choline pool that can be incorporated to make acetylcholine. So now you're understanding this a bit more. So here's how choline gets into the brain when it's just floating through the bloodstream as free choline. There's a choline transporter that brings it across the blood-brain barrier and into the brain parenchymal area. So after the age of 55, this transporter system becomes sluggish. So what I'm saying is that after the age of 50 or 55, everybody needs a memory support supplement that's going to help to deliver more choline across the blood-brain barrier, because just free choline floating around in your blood doesn't cross the blood-brain barrier very well as you get older. So slowly you deplete your choline pools from the phosphatidylcholine pools in the brain, and then you start having dementia or seniors moments that can lead to full-blown Alzheimer's. So after age 55, everybody has to be getting CDP choline into their body, and it doesn't occur naturally in food. Only supplements can do this. CDP choline has also been shown experimentally to increase norepinephrine and dopamine in the central nervous system, and therefore studies with Parkinson's patients also show value of providing CDP choline, because of course they're deficient in dopamine. So CDP choline restores the activity of mitochondrial ATPase, so you can make more ATP. And also the sodium potassium pump, so you can start pumping all that extra sodium back into the extracellular space to reduce edema. It inhibits the activation of phospholipase A2, as we said earlier, so you have less of the inflammatory prostaglandins being formed. And it triggers, which would otherwise trigger the formation of prostaglandin series 2. So in human studies, has anyone used CDP choline? Yes, in treatment of patients with head trauma. CDP choline supplementation accelerated the recovery from post-traumatic coma and the recuperation of walking ability. Its use achieved a better final functional result and reduced the hospital stay of these patients, in addition to improving cognitive and memory disturbances, which are normally observed after head trauma of lesser severity, and which constitute the disorder known as post-concussion syndrome. So these are people with really serious head injuries. They're in a coma. The CDP choline was well tolerated by patients. No serious side effects have occurred in any of the subgroups of patients treated with CDP choline. Unbelievable. Toxicity studies show it's very safe, even at high doses, 1,000 milligrams a day. Moreover, there's accumulated evidence that cholinergic agents are nutrients that increase acetylcholine synthesis. So they include not only CDP choline, but other natural agents called huperzine A and phosphatidylserine, which I put into a memory complex formula, which I'm going to show you, may alleviate some of the cognitive deficits suffered by head injury patients. As I said, you also want to increase ATP production to repair, you need more ATP to repair injury. Well, this is where creatine comes into play. So in mild traumatic brain injury, it reduces brain creatine and phosphocreatine levels in rodent models, so you get decreased ATP production. In the central nervous system, maintenance of cellular ATP levels is necessary for proper development and provides cellular energy required to maintain the various cellular processes necessary for proper neuronal structure and function and repair of damage. Creatine may serve as a neuronal code transmitter, augmenting postsynaptic GABA signal transduction. So GABA is gamma aminobutyric acid. It's sort of an inhibitory neurotransmitter. Studies of patients with CNS creatine deficiency and or murine models, mouse models with genetic ablation of creatine kinase, which is the enzyme you need to make creatine, have consistently demonstrated that if there's not enough creatine in the brain, there's significant neurological impairment in the absence of proper creatine and phosphocreatine or creatine kinase function, highlighting its functional importance. So in other words, one of the reasons nerve cells need a lot of creatine, because it converts into phosphocreatine. And then you see the phosphate group here, that phosphate bond will get released, and that produces a lot of energy. That energy can recouple ADP with inorganic phosphate to form ATP. And the brain uses the ATP for all its metabolic functions, to repair damage, to synthesize neurotransmitters, to do all kinds of things, stabilize the nerve cell membrane. So having more phosphocreatine in the brain allows more ATP production. But to make phosphocreatine in the first place, you also need acid. I don't have the graphic to show you, but you need S-adenosylmethionine to do that. So you also need folic acid and B12 at sufficient amounts to make SAMe, so you can make the phosphocreatine in the first place. So preclinical studies show a neuroprotective effect of creatine supplementation in acute neurological injuries. In rodents, pre-traumatic dietary supplementation with creatine monohydrate significantly reduced the magnitude of cortical tissue damage and the concentration of two biomarkers of cellular injury, free fatty acids and lactic acid, following the experimental injury. That means that if you have enough creatine from day to day to optimize all these functions, if you have an injury, the brain can make more ATP faster to repair some of the damage, so it's not as extensive. Creatine-mediated neuroprotection is in part mediated by the maintenance of cellular ATP levels, which we just saw, and improvements in mitochondrial bioenergetics, including increased mitochondrial membrane potential and reduction of mitochondrial permeability. So you start to repair the mitochondrial membrane damage, decreasing reactive oxygen species and the influx of calcium that damages the mitochondria. No drugs do this. These are what natural agents do. And human studies utilizing nuclear magnetic spectroscopy have demonstrated that creatine supplementation increases cerebral creatine and phosphocreatine stores. So when you take creatine supplements, they cross the blood-brain barrier, and nerve cells love to get access to creatine to form phosphocreatine so the brain can make more ATP energy and also use it for other neuroprotective effects. Several studies have suggested that creatine supplementation may also reduce oxidative DNA damage and brain glutamate levels in Huntington's disease patients. Human studies, preliminary results obtained in pediatric children have suggested that post-traumatic oral creatine administration at this dose, given within 4 hours of the traumatic brain injury and then daily thereafter, may improve both acute and long-term outcomes. Acutely, post-traumatic creatine administration seemed to reduce the duration of post-traumatic amnesia, the length of time spent in intensive care, and the duration of intubation. At 3 and 6 month post-injury, subjects in the creatine treatment group demonstrated improvement in indices of self-care, communication abilities, locomotion, sociability, personality, or behavioral and cognitive function when compared to the group that didn't get the creatine. Why aren't neurologists doing this? Further analysis of the same population revealed that patients in the creatine treatment group were also less likely to experience headaches, dizziness, and fatigue over the 6-month follow-up period. What do your concussion patients talk about? Headache, I'm so dizzy, I feel so tired. Creatine treatment appeared to be well tolerated, and there were no significant side effects reported, which was consistent with other human studies utilizing higher doses. You also want to provide antioxidant protection to quench those free radicals that are being generated and to help to quench L-glutamate. Huperzine A, by the way, we'll see this in a minute, protects the brain in various ways that are important. But one of the things it also does is it helps to decrease brain damage from L-glutamate, in case I don't mention it later. But right now, let's talk about vitamin E and vitamin C. Vitamin E is a potential lipid-soluble antioxidant that is present in high concentrations in the mammalian brain. Your brain contains a lot of vitamin E. It's in the cell membrane, protecting those free fatty acids, like the omega-3 fats, for instance, from oxidative damage. In several animal models of brain injury, such as ischemic stroke, subarachnoid hemorrhage, and Alzheimer's disease, administration of vitamin E has been shown to lessen oxidative stress and neuropathology. Other laboratory studies have demonstrated that pre-traumatic alpha tocopherol supplementation, if there's enough vitamin E in advance, it reduces traumatic brain injury-induced increases in lipid peroxidation because it's protecting those fatty acids, and you get less oxidative stress, and you have less impairment of spatial memory. The brain's working better when you can protect the phospholipids from oxidative damage. Additional studies in transgenic mouse models of Alzheimer's disease, these are mice now who are bred to have Alzheimer's disease, has further demonstrated that pre and post-traumatic vitamin E supplementation reduces lipid peroxidation, the formation of amyloid plaque. How important is this? And improves cognitive performance following repetitive concussion brain injury. So they take animals and they hit them on the head. Anyway, it's too bad. And in human studies of traumatic brain injury, emerging evidence that suggests that, look at this in human studies, daily intravenous administration of vitamin E following traumatic brain injury significantly decreases, oh, here's a word, mortality, and improve patient outcomes when assessed at discharge and at 2 and 6 month follow-up time periods. Importantly, no adverse effects were detected because, of course, supplements are very dangerous. This study also identified that high-dose vitamin C administration following injury stabilized or reduced perilesional edema and infarction in the majority of patients receiving post-traumatic treatment. Vitamin E and vitamin C work together because vitamin C helps to recycle vitamins. Vitamin E gets used up and its antioxidant properties get used up. Vitamin C can recycle. It can pick up the hydrogen electron and recycle that vitamin E back to its antioxidant state. They work synergistically and they provide neuroprotection sort of as a duo. You also want to improve cerebral blood flow. And this is where fish oil comes in again, right? Because the omega-3 fats as part of the phospholipids, they, just like choline, they can be cleaved off, converted into prostaglandin series 3 that reduces inflammation, improves endothelial function, and opens up blood flow. So you get more blood flow coming to the brain to deliver the nutrients you need for repair. Also making the platelets a little less sticky and stabilizing plaque, all these wonderful vascular effects. And you also then want to stabilize and repair the microtubule. What happens? I didn't talk about the axon. How do you repair the axonal injury? Well, there's evidence that niacin, vitamin B3, can do that. Nicotinamide helps to stabilize the tau protein. It's the tau protein that actually are the beams that hold those microtubules together. So human epidemiological studies suggest that higher niacin intake is linked to less Alzheimer's disease as you get older. Animal studies show that niacin supplementation reduces neurofibrillary tangles. So what happens in the Alzheimer's patient? They have a decrease in acetylcholine. They run out of the memory chemical. They form beta amyloid plaque, and then they form neurofibrillary tangles where the microtubules undergo disintegrate. They get degraded. They break apart because the tau protein beams can't hold things together anymore. So everything collapses, and then you have axonal damage, and then you have nerve cell death. The only thing that's ever been shown to stabilize the microtubules is niacin. There are no drugs that do it. Nicotinamide administration led to an increase in tau proteins that actually are the beams that hold the microtubules together. So here you see a nerve cell axon, and inside the axon you see these microtubules sort of blown up here. And it's these little blue things you see extending from the tubules. These are the tau proteins. They're like the beams that hold it all together. And when the beams fall apart, the microtubule breaks down, and that's the end of axonal transport. And these things coalesce to form neurofibrillary tangles. At that point, the nerve cell is going to die. So what we see is that when you have this degradation of the microtubules, what's happening is there's an enzyme that is activated called the histone deacetylase, or the HDAC. And then you all have reactive oxygen species, which is amyloid plaque buildup, and the alpha-tubulin deacetylation. This is what's causing the breakdown. Nicotinamide, this form of niacin, has been shown to inhibit this HDAC enzyme, increasing histone acetylation and enhancing memory and synaptic plasticity. These are animal studies now. Nicotinamide has prevented and reversed steps in Alzheimer's disease in transgenic mice prone to Alzheimer's disease. This researcher said, we found that nicotinamide restored cognitive deficits with Alzheimer's pathology. That's an incredible finding. So nicotinamide selectively reduces microtubule sort of degradation. And nicotinamide also dramatically increased the acetylated alpha-tubulin, which you want to happen, which is linked to increased microtubule stability. So here's some great research on that. And again, if you look at the microtubule here, these little red beams are the tau protein that holds it all together. It's a little more complicated, but it shows in the normal state what the normal status would be of the alpha-tubulin and the HDAC enzyme and the redox homeostasis or free radical homeostasis. You don't have amyloid plaque. When you, in a disease state, which can include after head trauma, you get sort of disruption of all of these things, and the tau protein falls apart. You get microtubule degradation with neurofibrillary tangles. As much as you can, you want to try to reverse that. So nicotinamide slightly enhanced cognitive abilities in normal mice. This suggests that not only is it good for Alzheimer's disease, but if normal people take it, some aspects of their memory might improve, said a very important neurobiology professor. Scientists also found that nicotinamide-treated animals had dramatically lower levels of tau protein that leads to Alzheimer's tangle lesions or neurofibrillary tangles. To apply what we saw in animal studies to humans, you'd have to take 1,000 milligrams of niacin or nicotinamide 3 times a day. It's a very high dose, and I think it's too high a dose for us to be playing with, because high doses of niacin in any form can actually damage liver cells. So sometimes they give high doses of nicotinic acid to raise the HDL level and bring triglycerides down. It works, but they have to monitor liver enzymes to see that the liver is not being damaged by that. So we can't just play around with high doses of nicotinic acid. I just wanted to see this research, because giving them more niacin than a person typically gets from the diet, I think, is going to be useful. Other nutrients of interest we're not going to see today are vitamin D, green tea, catechins, resveratrol. There's some evidence around these nutrients that you might want to explore. And then there are these researchers who also noted that, this high influx of magnesium into the cell after injury produces a whole lot of things that lead to neurological deficits and decreased ATP energy and destabilization of the membrane potential. So what they did is they created an IV therapy called Pro-IV, which has magnesium and zinc, and it's a cocktail of other micronutrients and some anti-inflammatories and non-opioid pain relievers. And they give the athlete or the patient this as an IV. So you might want to keep your eye on some of that research as it moves forward. But for our purposes today, I'd like you to understand how to use nutritional medicine in concussion and mild traumatic brain injury and post-concussion syndrome to repair the plasma membrane, help decrease inflammation, increase neurotransmitters, including the memory chemical acetylcholine, increase ATP production, reverse mitochondrial dysfunction, get more antioxidant protection in the brain, decrease damage from glutamate, improve cerebral blood flow, and stabilize and repair the microtubules as best you can. So that should all make sense to you now, and that should be something that's on your wish list for all of your concussion patients. So how can you do that? Well, you can give them a nice omega-3 fat supplement that has a high EPA-DHA concentration. Remember that study I showed you from the Brain Health Education and Research Institute? There's their protocol there. You give them CDP choline supplementation of 500 to 1,000 milligrams a day. Most health food stores will have this, or they can order it online. I would give them Adëeva Memory Support Complex. It has some additional choline, CDP choline, but it also has the other cholinergic natural agents that increase the synthesis of acetylcholine and also some of the phospholipids in the brain. So it has also phosphatidylserine in it, has huperzine A. Huperzine A slows down the breakdown of acetylcholine, and Bacopa monnieri, I showed it to you early, helps to decrease damage from glutamate damage, but it also improves nerve conduction and memory consolidation and quenches free radicals in the brain. It's used in the Indian medical system as a powerful memory support nutrient to bring early dementia back to a normal function. So Adëeva's Memory Support Complex should be in your protocol. Along with giving them, make sure they get enough choline in their diet to begin with, and some phosphatidylcholine, I would suggest 3 lecithin capsules a day, 1,200 milligrams of lecithin capsules. Any drugstore would have this, very inexpensive. The Adëeva all-in-one high-potency multivitamin has the extra antioxidants they're going to need. The vitamin C, the vitamin E, has the B50 complex that you need, folic acid, B12, 50 milligrams of niacin, and 1,000 IUs of vitamin D, important for the brain as well. And also, we make a product called Adëeva Creatine Plus. A lot of practitioners don't know that we make this, but it's a special type of creatine. It's micronized, so the absorption's better, and it mixes better into the juice that you're going to put it in. But it also has has L-glutamine in it to stop lean mass catabolism, support the immune cell. It also has ornithine and arginine that stimulate the release of growth hormone to help athletes, particularly who are training, get a better overall benefit in terms of anabolic gain. So we'll come back to that. Other supplements to consider are curcumin, alpha lipoic acid, CoQ10, additional nicotinamide at high doses. But remember, you'd have to be monitoring liver enzymes. But I will tell you honestly, if I or a family member was sort of slipping into dementia, I would sit with the family doctor and say, look, I want to use some high dose nicotinamide, but I'm hoping you'll track the liver enzymes to make sure that we're not doing any harm here to any internal organs. And hopefully you'll get a buy-in. So if you can monitor liver enzymes, I think it's something worth trying. I've known some patients who have done this. Vitamin D blood levels, you want to make sure they're above 80 nanomoles per liter, below 140, but above 80. And if for American practitioners, that would be 32 nanograms per milliliter. That's the level of vitamin D. The brain uses vitamin D for many purposes. So in terms of some of the supplements that Adëeva makes, I'd like you to know about, here's our Adëeva Creatine Plus. In 2 scoops, you're getting 5,000 milligrams of micronized creatine monohydrate, but you're also getting 500 milligrams of L-glutamine, which is anti-catabolic. When you're working out, you're breaking muscle tissue down. This helps to prevent some of the breakdown of lean mass. So you're getting more net anabolic gains. Remember that L-glutamine is also the primary fuel for many immune cells, so it helps to increase immune resistance and decrease the chance that athletes are going to get sick throughout their training cycle, because they tend to have more upper respiratory tract infections when they're training hard, as you know, often due in part to a decrease in glutamine, which immune cells need to make energy. It also has ornithine and arginine, which are amino acids that stimulate the release of growth hormone from the pituitary gland. It then goes to the liver and increases the synthesis of insulin-like growth factor 1, which then has anabolic effects on lean mass. So sort of a safe way to get an anabolic effect without putting the person onto steroids per se. So this is an incredible little supplement that has a great deal of application. The research supports its effects on improving explosive power and speed endurance in exercise training, increases lean mass and strength training along with protein intake, decreases muscle breakdown, so it's anti-catabolic, so you get better net anabolic gains, supports the immune system, as we talked about, supports increased growth hormone release, upregulating the release then of insulin-like growth factor 1, which you can measure it in the blood as the IGF level might improve by 10 to 20 or 25%. It also increases activity of the GLUT4 transporter that helps glucose get into the cell. So it helps to improve the management of pre-diabetics and type 2 diabetics, very significantly bringing their blood glucose down and their hemoglobin A1C. Has tremendous anti-aging effects for anybody over the age of 50. Older people, when they take it, they start to get their lean mass back, their strength comes back, even if they're not exercising. They start to get lean mass recovery, because creatine also works on an epigenetic level to stimulate muscle protein synthesis. And in neurodegenerative diseases, because the central nervous system requires creatine and it has so many different effects there, it's been shown to improve Parkinson's disease and other neurodegenerative conditions, including MS. It helps with congestive heart failure because it gives the heart more energy to make ATP so that it can pump with greater force. A person is immobilized, they're in a cast, they can't move their limb, normally they undergo atrophy. Giving them creatine during that period decreases the amount of atrophy they suffer, so the rehabilitation is faster. This has all been proven. And in concussion management, I showed you the research on it. So I summarized all this research with all the references in this review article that you can find at Adeeva.com when you go to the link to the product. This is our all-in-one multivitamin, right? It's enriched with vitamin C at 1,000 milligrams, all the antioxidants you need here to protect the brain with 1,000 IUs of vitamin D and bioflavonoids, everything from A to zinc. 2 caplets twice a day gives you the full adult dose. It is the most potent multiple vitamin made in Canada. And of course, these are the nutrients that you see in the multivitamin. You can spend more time here, but there's the C and the D and the E, the B50 complex here. And calcium for bone support, not too much iron. It's not going to be toxic unless you have hemochromatosis, you'd know not to take it. Selenium at 200 micrograms, very important for the immune system and as an antioxidant, as you know. Everything down, lutein for your eyes, lycopene for the prostate and cervical tissue. It should be everybody's foundational multivitamin, unless there's a reason why they can't take it. And here's our Adëeva memory support with the CDP choline, with the phosphatidylserine, right, which also helps to make more acetylcholine and is also an important phospholipid itself for nerve conduction, signal transduction. Bacopa monnieri, which is used in the Indian medical system as a brain antioxidant to stop also glutamate damage for better nerve conduction. And huperzine A, which slows down the breakdown of acetylcholine, so you have higher brain levels and you have then better memory restoration. Our Adëeva essential oils, I think, is a good foundational supplement because it has borage seed, flaxseed, and high-yield fish oil all together. So it's doing all the things you want, slowing down cell division, opening up blood vessels, making your skin smooth. It's anti-inflammatory, supports the brain. And then in addition, I would consider using a fish oil that's very high in DHA. So you might want to look for that in the market to complement this in any type of concussion situation. And then we make Nature's Relief, which has all the curcumin in it, all this curcumin, right? A standardized grade of turmeric, which is 95% curcumin with the other anti-inflammatory agents like boswellia, white willow bark extract, and ginger to help decrease the inflammatory cascade that's going on. If you want to give them some additional curcumin in addition to this, I wouldn't stand in your way, but I think this is the foundational product to start with. And so that sort of wraps it up. Now, what I would say is that some of these nutrients should be used prophylactically as well, right? So if an athlete is involved in training or they're in a sport where there could be some kind of brain trauma or risk of concussion, then they should be making sure they're getting enough creatine each day and omega-3 fats, these prophylactic things, antioxidants each day. So if they have an injury, they already have some of these protective agents to rely on so the damage is going to be less. That's what the evidence shows is possible. And so then using the therapeutic doses that I showed you with these types of supplements, to help the person recover, in addition to the fantastic work that you're doing with these people. Hands-on with treatment, and then the right advice around exercise at the appropriate time. So this is a huge part of the story that's been missing from the management of concussion, in my view. So I hope you've enjoyed this presentation. I want to thank you very much for attending. Hope to see you very soon at an upcoming webinar.